Nobody teaches you how to run a book of business. I learned it the hard way over 30 years, and I'm going to save you that. Welcome to Account Management 101. This video is a practical guide for new client account managers in group healthcare. We will cover the essentials of managing your book of business, the industry language you need to know, and the strategies to build strong, lasting relationship with your clients. In this video, I will walk you through the entire cycle of account management. From mastering key terminology like funding models and plan types, we will also look at how to handle service issues, manage the renewal process, as well as the open enrollment process. Hi, I'm Debbie Holt, a licensed benefit professional with over 30 years in group healthcare account management on the carrier side. I had a very fulfilling career in every way. I worked with great people that I loved and rewarding pay and benefits. But when I started, there was no manual for this job. I had to figure out the renewal process on my own. So I created GRAT, the Group Healthcare Renewal Advantage Toolkit, because nothing like it existed to help guide account managers through this process. At the center of it is the annual executive renewal calendar. It walks you month by month, January through December, so you always know what's coming next and can anticipate what your client will need before they even ask. GRAT also includes an open enrollment interactive checklist and an RFP vendor assessment scorecard, so every stage of the renewal has a system behind it. I built these tools for you so you can learn the process faster, build your confidence, and create strong, lasting trust with your clients. As an account manager, you are the client's trusted guide. Your role involves solving daily service issues, running renewals, implementing plan changes, and managing the complexities of open enrollment. Success in this role comes down to building strong relationships and staying organized by tracking every detail so nothing slips through the cracks. While no 2 days are exactly the same, most follow a consistent rhythm. Your morning should focus on triage and urgent issues. Mid-morning is for your to-do list, while midday is best for calls and meetings. Save your afternoon for project work like renewals and finish your day by confirming tomorrow's priorities. Managing a book of business means handling many clients and many renewals, each with unique needs. To stay on top of it, organize by renewal date, maintain a detailed client information form, and keep a consistent note system. Always prioritize tasks using a simple triage habit. To speak the language of benefits, you must understand funding models. Fully insured plans are state-regulated, filed documents with Department of Insurance and have fixed premium rates, while self-funded plans or ASO groups are federally regulated under ERISA, where the employer assumes all the financial claims risk. Know which model your client is using. Clients will rely on you to explain complex plan terms. Familiarize yourself with plan types like HMOs, PPOs, and high-deductible health plans, as well as essential cost-sharing terms such as deductibles, co-pays, coinsurance, and out-of-pocket maximums. Being able to explain these in plain language is a guarantee of a professional account manager. The work you do matters. Healthcare is one of the largest expenses for any employer, and the decisions you guide them through impact real lives and real money. By managing these plans well, you provide significant value to both the companies you work with and the millions of employees they cover. Service issues is where you can really show your value. How you respond defines your reputation. Always listen and log the details. Acknowledge the issue quickly, work through the correct channels to resolve it, follow up until there is a formal closure, and document the final outcome. Moving on to the renewal process, which follows a quarterly cycle. Use Q1 for data and strategy, Q2 for meeting with your carriers and market analysis, Q3 for execution and preparation, and Q4 for enrollment and closing. Starting your data collection early is the key to a successful renewal. I created the GRAT Group Healthcare Renewal Advantage Toolkit to include the annual executive renewal planner to assist in organizing this process for you. Please feel free to visit my website for more information. Successful implementation is about ensuring everything works on day one. Verify that plans, rates, and eligibility data are loaded correctly and match payroll. Most importantly, always test your technology before it goes live to avoid any enrollment and billing headaches later. Open enrollment is your busiest season. Plan your communications for 60 to 90 days out. This process generally involves 5 phases: preparation, communication, testing your technology, going live, and closing out the enrollment by auditing elections and updating payroll. Having a clear checklist will ensure you do not miss any of the many required tasks. To help you with this, I created the GRAT Open Enrollment Checklist so you don't miss anything key. Also, I suggest vacation should be at a minimum during this peak season. Being responsive builds client loyalty. You do not need to have an instant answer for every question, but you must keep the client informed. Acknowledge receipt of messages, set clear timelines for updates, keep your promises, and always close the loop when an issue is resolved. Reliability turns clients into long-term partners. Finally, focus on building your relationships. For new clients, earn trust early through transparency and quick service wins. For existing clients, schedule quarterly check-ins and remember the small details. Trust is what turns a client into a partner who continues to work and renew with you. AI tools can help you work smarter, not harder. You can use them to draft client emails, simplify complex carrier language and contracts, summarize documents, help build presentation for utilization carrier meetings, or even brainstorm content for enrollment. Just remember the golden rule: never input a member's private health information into a public tool, and always have a human review the output. It is very normal to feel overwhelmed when starting out. Focus on your first 90 days to build a strong foundation. Spend time learning your book of business, understanding plans and funding, include outreach to your clients, and it's especially helpful to know your resources. I get it. This is a lot to take in. To help you stay organized, I have created the GRAT Group Healthcare Renewal Advantage Digital Excel Toolkit. Included is an annual renewal interactive calendar, an RFP carrier assessment scorecard, and an open enrollment interactive checklist. These are available individually or as a bundle on my website. Stay organized, stay responsive, and keep learning. For more videos like this, please subscribe, like, and share for anybody who might find this helpful. I do appreciate any feedback or topic recommendations. Thank you so much for watching.